Hi, my name is Ashley Urdiales, and I'm doing my presentation on Cleveland Clinic. I would like to welcome CEO DeLois M. Toby Crossgrove and Chief Operating Officer Robert Wiley, along with the board for the community involvement. I'd like to welcome you and thank you for allowing me to present to you today. I have researched Cleveland Clinic and noticed that you guys are very much committed to the success of Cleveland Clinic. And throughout this presentation, I have highlighted a few strategies that I think can really improve the organization. I just wanted to start off with some background that I've learned about Cleveland Clinic is they've had over 52 million visits in 2013. They also had a record-breaking year with 50,000 visits to their website. They also had 56,000 people make online appointments. And they also had 111,000 people contacting Cleveland Clinic for inquiries through their website about their services, what they offer, where they're located at, etc. They've also been successful marketing on social media. They have millions of viewers following their Health Hub and YouTube videos. They have 80,000 followers on Twitter and 600,000 Facebook likes. Cleveland Clinic has expanded into many states throughout the United States, and they've also are opening their second international location this year, which is in Dubai. Their first international location was in Canada and is proving to be a success so far. There are a few key issues that are going on with healthcare that not only affect Cleveland Clinic, but also their reimbursement rates. Due to the implementation of the Patient Protection and Affordable Care Act signed by President Obama, the Centers for Medicare and Medicaid have been linking their reimbursements partially to how we're performing as a healthcare organization. If you're not in the top 10%, they are decreasing reimbursement rates 1 to 2%, and you probably can foresee this continuing on. Another problem that was identified through Cleveland Clinic is low patient satisfaction and engagement scores. It's important to get patient satisfaction and engagement scores up because not only do we want to make sure we're reaching the patients and contacting them, but also to make sure that they're improving, they had a positive experience, they would recommend our hospital for their services, and they'd come back to Cleveland Clinic. Those loyal customers are what's going to help Cleveland Clinic in the long run. Another issue identified is the low Hospital Consumer Assessment of Healthcare Providers and Systems, the HCAP scores, which is a survey done by the Centers of Medicare and Medicaid Services. Your scores are available online, so not only can you, but also the consumers and patients can go online and see how we're doing as compared to other competitors in the area or throughout the whole nation. These scores not only affect how our patients are doing, but also how they perceive the organization as a whole. Most of these scores stem from other problems or that can be addressed wholeheartedly through communication with the patient. The fourth recommendation or an issue that was identified is a decrease in the hospital admissions and also along with that decrease in inpatient services. Healthcare has been striving away from inpatient and long-term hospitalization. Hospitals have been trying to get their patients into the rehabs or long-term care facilities. And also there has been a lot of increase in outpatient services throughout the nation. With technology and innovation, we've been able to move a lot of the surgical services to an outpatient basis, which also leads to less recovery time and also cheaper costs for the patient. Another issue identified is ways to increase referrals and in-state transfers. While Cleveland Clinic does great within the 7-county radius, they don't have a large percentage of patients coming throughout the state of Ohio, nor other areas in the United States. With the Patient Protection and Affordable Care Act, we also had the higher motivation factor for hospitals and healthcare organizations to implement a successful electronic health record. Cleveland Clinic has done that, but we could always improve upon, have people join our accessibility with our EHR so we can help improve patient care and patient outcomes. One final recommendation or problem I found is the decrease of waste and efficiencies in order to decrease the long-term debt. Throughout the recent couple years, we increased $2 million in long-term debt, equaling a total of $3.8 billion. While that does contribute to the success and the new building of the Cleveland Clinic in Dubai, we still have the opportunity to find different ways to decrease our waste and inefficiencies within the system, which not only helps our system but also the environment. My first recommendation for Cleveland Clinic is to increase the patient satisfaction scores, which will in return increase the HCAP scores and enable Cleveland Clinic to qualify for full reimbursement from Medicare and Medicaid services. Hospitals and healthcare facilities are all competing at a very high rate right now for this reimbursement. It's important that we do get our full reimbursement because hospitals aren't as profitable as they once were. There's a lot more competitors and a lot more high costs that are involved with providing patients with care. The second recommendation is for Cleveland Clinic to increase their overall marketing efforts, but target their international patients along with in-state of Ohio physicians for referrals and transfers. While Cleveland Clinic does have quite a few transfers into their facility, there's always room for improvement to gain more. Also, when you talk with physicians that are specialists at other healthcare facilities, they may not realize what Cleveland Clinic is capable of doing. So even if we can help them provide their patients with care, or they can recommend us for follow-up care or further advancement in medicine, that is one thing that Cleveland Clinic can improve upon. The third and final strategy I'm recommending is to fully utilize the electronic health record to increase patient care and accessibility. And this includes outside physicians and facilities. Cleveland Clinic has a contract with Dell that has enabled them to help build the electronic health records. Outside healthcare facilities and physicians' health practices can contact Cleveland Clinic so that way they can set up appointments and help them build their electronic health record. So that way Cleveland Clinic can use their experience and expertise on what works for them and what might work for the new facility. The first way to increase patient satisfaction, the HCAP scores, and patient engagement scores is to increase the first patient interaction, setting the tone when you first meet the patient. This includes nurses, receptionists, even if it's the physician for the first time. We want our healthcare providers to take the time with the patients, listen to their concerns, figure out what they really need, and find reasonable solutions that work with them. Teamwork is huge in healthcare, along with communication with the primary doctor. It's not just one physician taking care of a patient anymore. It's a whole team and specialists of doctors and also mid-level providers. It's important that they all work together, they all know what's going on, and doing what we can to best serve our patients. Ways that we can do this are to train our managers what to have patients ask, what to have physicians, nurses, and healthcare professionals, how to talk to our patients, how to be more caring, compassionate, showing them ways to go above and beyond to help increase the patient satisfaction. Also, get ideas from your staff. They're the clinical staff. They're the people who are hands-on with the patients all day, every day. They know what the patients want, what the patients need, what the patients like, what they don't like. Ask them for their opinions, and then train your employees and encourage them to go above and beyond. It may take some time for everyone to understand these new concepts and ways of thinking instead of just trying to get patients in and out to increase or decrease wait times. One other final suggestion to increase patient satisfaction scores is Cleveland Clinic is a huge organization. There's many campuses. It can be hard for patients to navigate through the campus, especially if they're coming from a small town. Ways to increase this would be signs, visitors, when they come into the organization, have someone there to greet them and ask them, can we help you find where you're going? What are you looking for? What do you need? Some suggestions that I've came up with is have administrative teams, professionals, or healthcare professionals, physicians, and staff park in the visitor parking lot. See how hard it is on your first day of work to navigate where you're supposed to go. If they can't do it and they're working there, you need to readdress the situation. Also, we need to always take the patient's considerations seriously. If we can do anything to make their experience better, we should try to do the best that we can. In order to implement the marketing efforts in the foreign nations, we need to increase communication. There's primary care doctors everywhere, and we need to solicit our services, know what we're trying to achieve at Cleveland Clinic and how we can help your patients. For in-state transfers and referrals, like I said, building partnerships with them to see what we can help with their patients that other specialists may not know about. Cleveland Clinic is a research facility. They are constantly thinking of new ideas and new ways to help improve medicine. They're a part of many clinical trials. There's a lot more options for patients than there were 50 years ago with the increase in medicine and technology. You also want to build partnerships with businesses and schools. These will help gain loyal customers and also different patient populations and variations that we may not have thought. Marketing, we also want to show our compassion and our strengths of Cleveland Clinic. We want to show that we're able to provide our patients with the care that they need. We want to show that we're achieving our success by increasing the patient outcomes. We want to provide our patients with culturally and comfortable care, and we need to show that we can do that, especially when we're competing in the international market. In the international market, we also want to limit our services to what they really need. Everything that we do in America may not be culturally acceptable or needed in Dubai. We need to see within the first couple years on what service lines they are actually using and which ones they want or which ones we can bring over there that they may not have currently. The implementation for the electronic health record expansion is for the Epic Dell contract, like stated earlier. Cleveland Clinic is an expert in not only healthcare but implementing their EHR. They want to expand on the radius of Cleveland Clinic on the physicians who use their EHR. Helping other organizations and hospitals establish an EHR is important because if you're getting an incoming patient from those facilities, you want to make sure you have everything you need on that patient. If those companies contract with Cleveland Clinic and have the same Epic system as Cleveland, all their information is readily available at hand right on the computer for them when they get there. This not only increases the patient outcomes and the patient care, you're not waiting for results or paperwork. Everything's right there to help you make an informed decision for the patient. This would involve a lot of communication with other facilities. Many people don't know that Cleveland Clinic can help you build your electronic health record. It also takes other organizations. They need to evaluate their information technology needs and also their budget. EHRs can be very costly, but they're worth the investment, and they also qualify for the CMS payments or higher reimbursement rates. In order to evaluate the patient perception and satisfaction scores in the HCAHPS, obviously the HCAHPS are done by the CMS and their results are available online. The goal is to get the HCAHPS scores in the 90th percentile for 75% of the categories. Two of the biggest categories that I think we should focus on is communication with the doctors, communication with the nurses. The patients want to know who their nurse is, what they're doing to help take care of them, why they're there, how long they've been there for, what kind of experience that they have to make them feel comfortable that they're safe in their hands. The second, increase of communication with physicians. Physicians need to communicate what their plans are for their patient, why they're planning on doing. They need to give them the risk and their other options that are available too, because what's right for one patient may not be right for another. And also involving the patient in the decision is very important. Obviously, overall, Cleveland Clinic measures their patient engagement and patient satisfaction scores. And we also think the leadership team should help evaluate staff and physicians on how they're doing. They can always learn from the physicians and staff on what they can do to improve upon it, but also evaluating their techniques. Make sure they're actually taking their time to listen to the patients and gain clinical information that can help them make the best decision for the patient. The evaluation for the marketing. Internationally, I would like to see Dubai have patient volumes of 650 discharged within the first full year of operation. I would also like to see them increase discharges 5% each year after. This would be measured by patient volumes, again, like I said. We'd also want to see what service lines are being most popular and preferred techniques of healthcare. Like I said, it's important to get the patients what they need when they need it. So there may be things that are important for Dubai that aren't as important for the healthcare needs of America. So understanding and making sure we're providing those services that they need over there is very important. And then the patient population from in-state transfers, referrals, and out-of-state. Cleveland Clinic already measures those. Typically, it involves your registration and your quality control staff. When they get registered, they ask where they're from, and incoming transfers, what facilities are transferring, and what physicians send us a lot of transfers. We need to monitor that and then increase on who we're targeting and let them know what we can really do for our patients. The evaluation for the EHR expansion is the radius of hospitals utilizing Cleveland Clinic's EHR/the Epic system. All affiliated healthcare providers should be and hopefully are fully capable of utilizing EHR to its full potential. Full potential means qualifying for meaningful use by the Centers of Medicare and Medicaid Services. And we also want to monitor how many hospitals and healthcare facilities are seeking Cleveland Clinic's knowledge and expertise on what to do and how to build their EHR. Sometimes our EHR may not be as cost effective for an organization, but we want to see what we can do to help them. There is a limited expansion with EHR because in 10-15 years we're going to have it fully implemented, and every healthcare facility, healthcare organization is going to have EHR. So eventually there's going to come a time when this strategy doesn't work for Cleveland Clinic, but for now it's something we can definitely capitalize on. Concluding, we need to increase our patient satisfaction in order to not only satisfy our patient, but improve the patient's outcomes. We want our patients to get better. We want them to feel better, live a healthier lifestyle. We can do that by increasing their knowledge on what to do. When patients and doctors communicate frequently and are informed of each other, patients are more to comply with their medications and their recommendations made by their physician. We also want to expand the number of patients seen at Cleveland Clinic and is willing to help. We've been able to reach a lot of patients online, even if they aren't our patients. They may be our current or our future patients, either today, tomorrow, next month, next year, 5-10 years down the line. We just want to make sure we're helping people to live a healthier lifestyle. Also, the electronic health record can help us investigate further into the patient's history and find underlying problems. Since we have the EHR, we'll be able to have their lifetime records that are in the electronic health record. We can go back and see, oh, when they were a baby, they did have heart problems. So that way we can run further testing if later in life they're having chest pain or things like that. We also need to continue getting funding for our research. Without research, we can't be innovative, and without innovation, we can't educate and pursue success. Overall, Cleveland Clinic is doing well. I really think our patient engagement and satisfaction scores can increase. We just really need to increase our communications between all healthcare personnel. Again, this was Ashley, and I would like to thank you for taking your time to listen to me and listen to my recommendations. I truly appreciate your time, and thank you and have a great day.